do you have experience with higher doses of melatonin for other reasons than sleep? I've been told by other experts that 20 milligrams plus doses is also beneficial for its antioxidative and anti-cancer effects.
Yeah, melatonin is obviously like a bioidentical endogenous hormone, very similar to other hormones. It's kind of the opposite of cortisol, and it has a circadian rhythm. I believe there's 3 main melatonin receptors, and the third one, one of the 3 is somewhat related to hormonal status. For example, at very high doses that theoretically could affect FSH and LH. So for that reason, in pediatric patients, usually dosing only intermittently and at very low doses can be important. There's also medicines that only bind some of the melatonin receptors that can occasionally be used in adult patients. It can be an anti-inflammatory. Again, the dose makes the poison, to go back to that term. The pharmacogenomics of melatonin processing and metabolism is varied. So depending on if you metabolize your melatonin fast or not, you could require a very different dose or even a different speed of release. So for many people, melatonin can be a good addition. Around the time of andropause and menopause, melatonin levels also tend to drop. Melatonin is released by the pineal gland, a small gland. The Egyptians love the pineal gland, by the way. If someone wants to go down a rabbit hole, just look ancient Egypt, pineal gland, melatonin. But it's along the optic nerve, so as sunlight comes in, I believe the blue spectrum inhibits the secretion of melatonin. And then as that ends, the melatonin secretion ramps up toward the end of the day. So if the more impaired the endogenous melatonin signaling, the more a melatonin replacement will help as an anti-inflammatory. I can't remember if it's Matt Walker that said this, but sleep is, I suppose, our superpower. And good REM sleep and good deep sleep is 2 of the best anti-aging regimens. By anti-aging, I just mean all-encompassing cosmetic, protein folding, mitochondrial health, telomere length, all of it, along with zone 2 cardio. So I think that melatonin has most of its efficacy in improving the quality and sleep architecture.
So in some patients, you do advise high doses like 20 milligrams or plus?
Usually up to 10 milligrams. If someone has a full genome sequencing or full exome sequencing or pharmacogenomic testing, occasionally 20 milligrams or more. But for someone who wouldn't have that, for just an average person who's wondering if they should take melatonin for jet lag, when you cross time zones, it's particularly important, along with your lifestyle factors, like anything else, which, lifestyle factors are more powerful than any medication or supplement. But in general, somewhere between 1 and 5 milligrams, based on how you feel after taking it or how you feel the next morning, is reasonable to utilize even without specialized testing.
Okay. And is it right that I've been told that there's not really a negative feedback mechanism? So you can just stop and your own production will still be there?
There's no significant prolonged negative feedback inhibition from taking melatonin. So if you take it 7 days, then there's no significant negative feedback the day after that. So it can actually kind of help reset the rhythm that way. This is not necessarily the case when you're taking glucocorticoids.
Mm-hmm. Okay, right. So thank you so much for your input, Dr. Kyle. If people want to reach out to you, how can they reach you? What's your preferred route?
On almost all platforms, I'm Gillett Health, including YouTube. We have a Gillett Health channel now, so please tune in. On Instagram, which I guess is my main hub, it is Kyle Gillett MD.